I think first of all we need to differentiate the terminology, because lip reduction in a medical sense means that you make a lip smaller. Okay, and that would be more basically for people who have too big or too fat lips, if you want so, which most Caucasian people don't have. So when Caucasian people think in terms of lip reduction, they actually mean a lip lift. So they mean that, for example, that they have too much, that the gap or the distance between the nose and the start of the lip is too large, and then you reduce this part, and then it is a sort of reduction, but actually the tissue above the lip. And that we would call that a lip lift, because what it does, if you excise this, if you take this part of skin out above the lip, it does this. So it lifts it. And depending on how you do it, you can achieve that you show more red of the lip, or if the whole thing goes just up like a curtain. It depends on the design and where you cut. Now, so I would say probably lip lift is a better term for that. Lip reduction is something else. You have a very big lip and you want to have a less big lip, and you try to do something or certain excisions inside of the lip that makes the red of the lip smaller. So the lip lift is probably what we talk about. There are different ways of doing it. There are techniques where you cut directly above the lip. There are techniques where you want to hide the scar more and you cut basically just below the nostrils, and then different designs. We come to that later. But speaking of popularity, I would say 8-9 years ago I was only very occasional doing it, very occasional. In those days I actually got a lot of referrals from, again, a lot of Russian women actually, who did do permanent fillers in their lips just to augment them. And there's still a place for doing that. You know, it's not that this technique is completely gone, but what we did in the past was we put Gore-Tex threads into the lip to make them appear bigger, or you could take scar tissue and put this in the lip, or inject fillers that are permanent. Like I said, all this is still done nowadays. There's sometimes new designs of lip implants that you can use, but of course nothing is free of trouble. Yeah, so if you put something permanent in and you do get lumps and bumps and irregularities, it is not easy to deal with it, and sometimes it is impossible to get a nice result again. So there's some risk associated with it. Ever since there are, I would say, the quality of the non-permanent fillers has really evolved. This has become far more popular now. I mean, you have to do it again. People don't like that. However, the risk is definitely far lower than if you put something permanent into the lip. If lumps and bumps and irregularities do occur, so not what you want, then at least it has a good chance of going away when the filler disappears. Not always does that, but that's probably the reason why this has become more popular. Now, surgery, you can achieve good results and is increasing your popular, because fillers can only do a part. They can make the lip red bigger, but they cannot lift it. It just doesn't happen. It's only, let's say, if you have a tire and you pump it up more, that's what it does. But it does not lift anything. So anybody who says that, it's not really true. Yeah? So if you want to lift something, you need to cut it out. Yeah? And women know that. I mean, women read this stuff up. They're incredibly informed now. And there are basically two big ways of lifting a lip. One is that you make a design where you cut directly at the vermilion border, the white roll of the lip, yeah? And you take a little strip of skin just above, you mobilize the red of the lip and stitch it a bit higher. Yeah? So that reduces the distance from here to here, and it shows more red of the lip. If that heals well, then it looks really good. If you get a bad scar, then you have a problem, because it's very visible. So that is something that's important to balance that out. An attempt to not be so risky here and doing a line directly above the lip is to take the tissue from here, because there's of course shadow below the nose, and there's a design which is called Bullhorn Lift, because the part of skin that you take out has a bit of the shape of a bullhorn. That's a bit how it goes. It's an indirect lip because it's further away. It gives you some lift. The lift does not go as far to the sides as if you cut it directly here, because obviously you can probably get this kind of triangle to be lifted. I think it works quite well. Like I said, the beauty is that scars, even if they should not be that good, at least they're a bit more hidden here. So it's a bit more forgiving. And there's something that you would have trouble in achieving with a direct lip lift. You can, if somebody wants to show a bit more teeth, with this kind of technique you can basically lift the whole lip a bit like a curtain, yeah, and roll it out a bit. So you can do that. So in other words, it has an advantage. Again, the disadvantage is if you lift it too high, the teeth can get a bit cold and so on. So nothing is without, you need to balance it. But it's not a bad technique. You can, for example, do the subnasal lip lift, lift the thing a bit up, have the skin a bit less visible here, and then compensate and say, okay, I inject a bit of fillers and give you full lips too. So that is a nice combination, which is, I would say, low risk. Yeah, nothing is without risk, but I think it's pretty low risk. But now the advantage of the direct lip lift, you can achieve more. When you cut something directly out, of course, you can show more rate of the lip. So that's the advantage of that. So somebody wants it more extreme. A direct lip lift will probably be slightly more suitable with higher risk. Yeah? And for those who would be okay to come back, to have lip injection, I would say the indirect lip lift is a nice trade-off and gives you probably pretty good results, yes, in most people. Yeah. Can be done under local anesthetic. Nicer it is for the patient if you put them asleep for 20 minutes. Well, I would say if you do it nicely, it probably takes 45 minutes. I mean, I think 20 minutes is a bit short. 45 minutes. The advantage is if somebody is asleep, there's no anesthetic going in there that distorts the picture. If somebody is awake, you need to, of course, inject some local anesthetic, same as the dentist does. And then when you do that, no matter how nice your drawing is, you measure it, you draw it, it's still distorted because you stick something in, you blow it up. Yeah, because otherwise the patient feels pain. So in other words, when you do this surgery under local anesthetic, it'll be probably slightly less accurate than if you put somebody asleep. So my preferred option is short general anesthetic, day case, go home the same day, be accompanied by somebody that that it's sure that you don't, fall downstairs or something because you're still a bit drowsy. And then it is stitched, so little sutures. You can use dissolvable and non-dissolvable sutures, both is possible. It's slightly better for the scar quality if you use sutures that have to be taken out, but it's not compulsory. You can also use a technique where dissolvable will probably do the trick. I slightly prefer non-dissolvable. And yeah, that's a bit how it is. I mean, I have one practice here in London, one in Berlin. Both cities have I get quite a few Russian ladies. They just love it. More than English ladies, actually.
Yeah. Also about Russian customers, what do they tend to ask you? What is the trend in them?
You see, I have the feeling Russian ladies do anything for beauty. They really do. Yeah. So in other words, I think it is more that me as a surgeon, I need to get them a bit back down to earth and say, listen, this is what you can achieve and this is the risk. It's I actually need to slow them down than the opposite. So they're actually ready when they come. They know what they want beforehand, and you need to tell them the limitations and what it might not do. That's the way around. They're informed. They've seen it. They've seen it on the internet. They know the drawings. They even know often the design, how you cut. It's quite amazing, actually. So they're very well informed.
And Stefan, do you have a customer who, for example, had an injection or implant in their lips and in order to get them bigger, but now decided to go back to natural size? Do you do the same?
Yeah, I mean, obviously, if you have cut skin out, that's it. The lip will sit a bit higher. The little strip of skin goes in the bin. It's gone. You cannot have it back. Yeah. If you would like to put some tissue back, you would probably, you could in theory replace something. Let's say get a bit of skin from behind the ear and put it back, but it would look like a patch. you would see it. It would not be good. Maybe you would get away with it somewhere here. You can rotate a bit of skin, but directly above the lip, no, that's what you have. You know, with a filler, it's different. You know, I mean, what I sometimes do, let's say you have a lady who does not know what she really wants. Well, then a filler is great. Put a filler in, see if she likes it. If she doesn't like it, she won't come back. But if she comes back, you know she wants that. You know, so that's quite nice. And of course, you can also, in a way, I mean, it does not really picture it properly, but the direct lip lift, in theory, let's say a lady overpaints her lipstick. Yeah, I mean, let's say goes over the white roll. You can show a bit what it does. Yeah. But in the end, I mean, like I said, I mean, it is not completely normal because the white roll of the lip, you need to cut somewhere there, you know. So, but I must say, I mean, like, some ladies have very pretty faces, and this part is just very long, and it definitely looks better if you shorten that. It looks much better, you know. I mean, okay, not always, but I mean, there are candidates where I think yes, I mean, that would be really for you, you know. So.
Stefan, for example, if they put like implants or fillers, how easy is it to get fillers out of the lips, for example?
Very difficult. Very difficult. Yeah. Like I said, most people don't realize it. I mean, there was a time when permanent fillers in lips were extremely popular. Everybody did it, and so on. And like I said, those who don't have problems, great. They have nice lip augmentation for many years, great. Yeah. But those who develop lumps and bumps and irregularities, you can hardly get it out. I mean, you can try to cut it out, but I mean, it's not nice. Nobody wants to do it. You know, you might not really find it completely, and it still might be irregular. You know, I don't think there's a need for it now. I mean, there are now fillers, let's say 7, 8, 9, 10 months. And I mean, if ladies go to the hairdresser, I don't know, every 3 weeks or something, why not coming in my office once a year, we inject a bit, you know, and then let it slowly go down. And also you're in control. If you think, okay, I mean, there's a time I like bigger lips, now I want them smaller, well, it'll go naturally down, you know. So that's, so for lips, I'm a fan of non-permanent fillers. Have I injected permanent ones? Yes, I've done it in the past. Not in big numbers, thankfully, therefore I didn't have trouble with it because I've tried not to do high numbers. The non-permanent fillers, just to say that they can also produce lumps and bumps, but there's, you can get an enzyme into them and often break the little capsule that forms. So at least you can play a bit with it, you know. And the ones like that, those who have lip implants, which sometimes look super. I mean, I still regularly have ladies with lip implants which look really good. No problem at all. It looks good. Yeah. But those you could in theory take out. But of course, whenever you go in, you produce scars. You know, it'll never be as good as before. You probably, when you've taken them out, then need to replace part of the tissue with fillers. You know, So yeah, I mean, I don't know how many thousand lip implants have been done in the world. I'm sure I need to take a few out in my life. Yeah, that's probably part of the deal. Hopefully not from my own ones. hopefully from somebody else. But you know, that's a bit how it goes.
Stefan, this is the last one. Could you let us know what is fashionable nowadays in your field of area? What is a trend? What women tend to have more?
Yeah. I mean, like I said, lip lift is more popular. There's no question. I mean, that's definitely a different. Well, at least in my practice. I mean, I cannot give you any statistics, but in my practice, it's very clear. I mean, there's a trend that goes like that. Another thing that I realized is, and I'm not sure if you know these film stars like Brad Pitt and Angelina Jolie are responsible for that a bit. They have strong jaws. They have very, you know, they have good cheekbones, good jawline. I put far more chin implants in than I ever did before, and I also augment chins in general, let's say, in terms of moving the bones a bit. I do far more of those now. So I have the feeling that people want a bit more a three-dimensional, slightly stronger look. That seems to be, you know, a bit better jawline and all that. I think that's more popular now. And you know, there was a time when mankind didn't like that at all. You know, if you look at the old women that no, sorry, not the old women, the old paintings, let's say, of Rubens and all that painted the most pretty ladies in those days. They all had a relatively soft chin. You know, they had a bit this appearance. Well, that's not that popular anymore. So over time that changes. They also were, in today's terms, overweight. You know, so might change. Maybe 20 years time we take them all out again. But at the moment, I mean, I would clearly say more three-dimensional look. And then noses is slightly different. I think every nation has its own idea about noses. I noticed a clear difference that, for example, if you get Russian ladies, they want smaller noses like most ladies, but they want to keep them normally relatively straight. Whereas many of the British girls, they want a bit more scooped out, a bit more rounder, you know. And you could say that about, I mean, of course, it's generalization, and you know, but I think that's a bit of a trend. And the same, I go to one city here in the UK where they have a massive Asian community, and most of them, they're obsessed with this little part of the nose. They want this a bit more in. So I don't know where that comes from, but they're just ideas of beauty, you know. I mean, you know, let's face it, nobody needs that, but people want it, you know, that's how it is. Yeah.
Stefan,